Hello, this is Dr. Lewerenz, Longevity Health Institute. Hope this finds you well. Good afternoon or evening if you're checking in with us here at Longevity. Functional medicine, personalized medicine, brought to you the best way using an operating system of basically good medicine physiology to put it together. Now, why I want to talk to you about this is about a patient today that was new, that was sent from another patient of mine, and they don't really know what functional medicine is. They don't really understand what personalized medicine is. And so I had to explain. He was slightly frustrated, but I wanted to tell you the story. This gentleman was referred from an executive. They're partners in a group that actually they do a lot of networking, if you will, in corporations. They are presidents and CEOs of companies, and this gentleman in his mid 50s, the other gentleman in his 60s. Really big thing is just an overall, they want to be well. They want to be preventative. They want to be not reactive. They want to be in a wellness model. And through word of mouth, I guess they found us. So we're happy to have them here and give them the best guidance. But I want to explain to you in this person how I explained what functional medicine is and why, okay? Now, he has a doctor he sees at U of M, and he has a doctor that he's seen at Beaumont, which I'm on staff at Beaumont, and nothing is wrong. I mean, as far as he's happy with their care and all that. The other gentleman that was his friend actually goes to Cleveland Clinic and gets executive physicals and all that. But the difference in a good Western medical specialty approach in functional medicine is we're going to look at why, not just this is what's going on, here's your diagnosis, here's your drug, here's your surgery, here's how I approach it. We're going to look at a systems approach, an operating system in your body, how we can fix this, or at least adjuncted improvement in it that then could change the trajectory of your health in your life forever. Because if you don't address that, you're band-aiding a problem that's moving on to another problem, okay? Here's a story that I want to share with you. So this gentleman, actually very healthy, but in his mid-50s was discovered he had about a 50% occlusion of his LAD in his coronary artery. He had some bad genetics cardiovascular-wise, and otherwise he feels great. Now, he's been athletic his whole life, he's been fit his whole life, but he didn't know what to do with that, and he didn't understand it. And he's seen the best doctors, the best cardiologists, the best lipidologists, and he has on board, and he's happy with that. But he wants to understand why, and why this happened, and what could also be done on a dietary end, on a potentially reversal end, or at least putting the picture together. His word was, quarterbacking the whole thing. So, and this is what I brought to his attention, two things that he wasn't even aware of. And this is why you have to look at somebody as a whole, okay? And if you're out there listening, make sure you share this with others, because by all means, the practices, hospitals, doctors that they see are wonderful. They're highly skilled, highly educated, and they're specialists in their place. But if you don't have a quarterback, or you don't have somebody looking at you in a functional, personalized way, some things don't get put together and can get band-aided, okay? And band-aids don't hold forever, bottom line, okay? So this gentleman, he had some cardiovascular disease that was discovered. I said he had plaque in his LAD, which is your main, we call it widowmaker of your coronary artery. And he had some, elevated lipids, cholesterol, and no heart events, no stroke events, no hypertension, nothing like that. He also was evaluated by a GI doctor just because he thought he had a little heartburn. They said it was nothing because they scoped him. And anyway, and so in the spectrum, and I use this picture, he falls in the cardiovascular plaque range, like here, okay, where he's got, and we know this by these labs because he brought them to me, he's got some inflammation, he's got a little bit of plaque, he's got an enzyme that's being released and an inflammatory marker that we're testing be released, and he's got some calcium, okay? So he's down here. So what can we do besides using a statin, diet, whatever his cardiologist is using to stabilize this or reverse it, okay? And so what here in a personalized way can we look at and do? And what we can do and what we look at is, because your body works as a whole, okay? We're not just parts, we're a system, okay? And there are parts of the system that get overlooked when you see specialists or subspecialists. Not knocking them, just that's the facts, okay? So in his care, in his case, we talked and got a lot of details and spent our traditional new patient hour visit, and discovered that he actually still has this heartburn once in a while. And you've seen me in other videos, and if not, please watch my leaky gut videos and GI videos. But we looked at his blood here on the microscope and did cytology and saw that he has leaky gut. He has yeast, he has candida, he has inflammation happening at the digestive lining. We actually discovered, and we'll get his labs back, we drew, because I can tell on his dry blood, or what we call dark field, what have you, dry blood, it showed a big antibody and inflammatory reaction in his blood. When we see that, that tells me very likely, especially somebody with any GI symptoms, that they have leaky gut and they have food sensitivities and maybe even full food allergens, IgEs, reactions. He's unaware of this. He says nothing really bothers him when he eats or whatever, but it's causing a systemic underlying inflammatory reaction in his body. And the root cause of all disease, remember this, you've heard me say this in other videos, is inflammation and sugar. And that will cause this, that will cause plaque, okay? So point being is we're gonna dig in and discover what's going on in him digestively, besides give him a little bit of advice on top of his lipidologist, on top of the cardiologist, and their good help, okay? But then something else was brought to his attention that we're gonna look into. So he had a family history of early onset dementia in his father. Besides father, and I believe uncle, and maybe even brother, I believe, if I recall right, that had some of that cardiovascular risk, okay? So we're gonna dig into also his brain health. And why? Because the brain and heart are very connected. They're approximately about a decade apart, meaning when you start to have heart issues and cardiovascular issues and circulatory issues, you have about a decade before you're gonna show cognitive issues, even if they're mild cognitive decline, or something that we follow here on like brain speed and that, okay? So we have a window here of when we can intervene and not just help his heart, but also help his memory, his cognition, his brain, and limit or extend out in life his dementia or Alzheimer's. So we're gonna do some genetic testing, and we're gonna look into a brain test we do called a WAVI test, which is a EEG, a evoked potential test, that looks at brain speed and brain power and reaction time and all that. And we have some interventions to not just see what that is and use it as a cognoscopy, a brain colonoscopy, or a baseline test, and so we can track that months or years from now, but also where and what would help him in brain prevention, okay? I use actually Dr. Amen. I pulled out one of my books, Dr. Daniel Amen's protocols. This is one of his books, Memory Rescue, excellent book from Dr. Daniel Amen. Follow protocols of his where we consider things like inflammation in the blood and toxins and hormones and stress and sleep and learning and making sure that you're learning new tasks and you're working on these things so that we're not just brain inactive or complacent, and evaluating concussions and traumas to the brain and skull, and inflammatory reasons like high sugar, prediabetes, obesity, etc. So I use a lot of Dr. Amen's protocols to not just evaluate, but to reverse. He's definitely one of my mentors and I look up to. Okay, but when we use this WAVI test, we will get in this gentleman a good baseline, like an EKG or whatever, where his brain function is. Because we have a window here, he's 55, to make sure that at 65, he still has that brain health just like he has now, and maybe we can even improve and make it better. So that's our goal, and that's essentially what functional medicine is. Looking at root causes, being preventative, not reactive, and treating somebody as a whole individual, an operating system. So hopefully that makes sense. Share with others, because a lot of people don't understand what functional medicine is or personalized medicine is, or old school, what we used to call anti-aging. Okay, yes, we're holistic, but we're integrative. Okay, so personalized functional medicine is looking at root cause and solving problems. Hope that enlightens you. So have a great week. Share this with others. Subscribe to my channel. Go to our website. You'll learn a lot. Got a podcast coming out soon. And I hope to bring you always and share with others the best in functional personalized medicine. Be well.